I think there's some missing, but no doubt they'll join us as and when. But we'll make a start. Item 1 on the agenda: apologies for absence. We've got apologies from Carl Crompton, Councillor Carl Crompton, County Councillor Miles Parkinson. We've got County Councillor Beaver and Dawson replacing them. Welcome, Lorraine. I'm not sure whether Bernard's with us yet, but
he's probably having IT difficulties, but he definitely will be trying, knowing Bernard.
Yeah. So we'll welcome when he comes.
Okay.
Item 2: are there any pecuniary or non-pecuniary interests? No. Thank you. Item 3: minutes of the meeting held on the 10th of September. Do we agree those as a correct record?
Agreed.
Yeah.
Agreed.
Thank you very much. So that brings us to item 4. Before I do that, can I just remind colleagues to keep your microphones off when you're not speaking, Keith? And if you want to speak, stick your hand up and I'll do my best to notice you. And if I miss anybody, I'm sure the officers will tell me. Okay. Item 4. Over to you, Donna.
Hello, thank you very much. This is the corporate strategy monitoring report, and it isn't as comprehensive as it would have been had we not been in the middle of a pandemic, but it's a pretty comprehensive report, and it covers Q2 and 3 performance information as far as it's been possible to get hold of that information. So I'm going to go through the Appendix A, which is the corporate performance report. Appendix B gives us more detail on adult and children's services, and it supplements that's in the corporate performance report. And we've also got a list of reports that have been presented to other committees, which will give a sort of taste of the impact of COVID-19 on the work being undertaken. But we're not going into any detail in relation to these reports. They were for information only. And Appendix C is the customer access services work that they've been doing in response to the pandemic to support Lancashire County Council. So we have a number of officers that are round our virtual table, and we'll be introducing them to lead certain items. I have to say that Tony Pounder, who's the Director of Adult Social Services, has to leave at 3 o'clock. So he's asked me if he can take his items earlier. So if that's okay with you, County Councillor Driver, can we take those first?
Yeah, absolutely fine. Yeah.
Brilliant. So so we'll go straight into the actual report itself. And if I can invite Tony Pounder to start on page 6 of your Appendix A, which is starting with 3 indicators. If you've all got, I think it's page 18 of your report, the actual report, page 6 of Appendix A. It's a bit confusing, but we're starting with the percentage of adults and older people whose desired safeguarding outcomes are fully met, and take it from there, if that's okay. Handing over to you, Tony.
Okay, thank you, Donna. I think in general, I'll repeat, Chair, some of the comments I made in the last meeting on this topic, which is our focus, as you will appreciate, over much of the last year has been on COVID. So many of these numbers, if they've moved at all, they have moved sometimes not by focus and design, but because they've simply moved because numbers will do. And you'll see both in terms of the provision of the last two, which is provision of services in the community and the CQC ratings of residential care homes and domiciliary and other agencies. Those numbers are pretty well flatlined, and that's not been because things in the real world haven't changed. It's because CQC's activity to inspect services hasn't shifted anything like the same volumes of inspections as they would have done in previous years. So those numbers have stayed fairly static, and I think what we would probably reckon is based on increasing anecdotal evidence, is that within some of the care home provision that we've got, which is the second of the three indicators on here, we probably will encounter some challenging situations amongst the care homes in Lancashire, because many of them have actually been operating at times in relative isolation over the last year. They've not always had a lot of visitors from family, from CQC, or from ourselves. And it's been an incredibly challenging time for them. So we know once CQC start going into care homes, they are going to find some fantastically good and great quality services, but we do anticipate that they're also going to find some services which have drifted below the kind of quality thresholds they may have had expected to meet before. So that's not a reflection on these numbers, it's just a reflection on what I think we may see in the year ahead, and I suppose it's trying to give you some colour to what otherwise might be a picture that looks like it's not really shifting very much at all. And in terms of the safeguarding outcomes and the delivery of those, well, again, our safeguarding adults team, these outcomes are very much based on surveys that we conduct with the people who have actually had a safeguarding investigation in relation to their needs, and we simply say, you know, are you satisfied that we've got there? Now, I suspect people's experiences over the last year have not been as good as we would always wish them to be on some of these matters, because we are severely stretched in terms of the degree to which we can always kind of follow up in terms of satisfaction around some of these issues. We obviously have to prioritise, but I think we will return to a more focused approach around our safeguarding and look to be targeting those thresholds around 70%, which was what the target was for this year, as we hit the new financial year. And I would hope certainly for the next, the first quarter and second quarter of next year, we'll start to see a trajectory which starts to move upwards towards those numbers.
Thanks, Tony. Did you want to comment, Graham, or?
No, not thus far. Yes, on the safeguard.
Whoops, you're frozen, Graham. It looks like we've lost the connection.
I can hear you.
We've got you back now too. Fire away.
That's right. I was just going to say on the safeguarding.
You could do to safeguard your connection. We've lost you again.
Maybe take your camera off, Graham.
Yeah.
Do you want me to sing a little bit while we're waiting?
No, thank you. No,
Okay.
thank you. No.
Okay, I've turned my camera off. Can you hear me now?
Yes, we can. We've got you.
Yeah.
No, we've lost you again, Graham. We'll come back to Graham. He's obviously going to make a point on the safeguarding. But Tony, do you want to move on to your bit on Appendix B?
Oh, wait a minute. We've got a few more performance indicators to go.
Donna, lead us forward, Donna. Yeah, I'm struggling to follow the pages.
On page 10, we have the percentage of adults with learning disabilities. That's actually, page 22 of your overall report.
Sorry about that.
That's okay. I mean, just a very quick comment, which would be the repeat from last time, Chair, which is that obviously the last year has been a bit of a shock to the economy in general. The staff that we'd got in place to work particularly hard on improving this position, they, for much of the last financial year, have been deployed in other areas. I think we had a short period in the autumn when we thought that we were going to get back to normal, and that didn't actually transpire because of obviously, the second / third wave of COVID. So it's not, it wasn't a good position before the pandemic. It's remained not a good position during this period, but we obviously have got to look forward to the new financial year, the new operating arrangements that we'll have post-COVID, and optimistically, I think we will need to drive this forward, even though again we will still be facing some challenging economic circumstances for anyone looking for work.
Yeah, absolutely. Yeah, thank you. Are you with us, Graham?
Again, are you with? Are we there?
Yeah, it breaks up, but I think we might have got you. Yeah.
Yes, because the difficulty for employment for people with learning disabilities is a lot of them are employed in the hospitality industry, and that has virtually closed down, and that's the big problem we've got.
Yeah, understood. Tony.
So am I on to page 26 now, Donna?
Yes, you are. Yeah, that's right.
It's a challenge with when there's lots of numbers actually on these pages, Donna, which I keep being panicked by the different numbers. Anyway, so on this page you will see there are on this page and the next page on 26, 27. These are numbers really which are designed to capture a sense of are we keeping people in the right place for them to receive support, which obviously predominantly we want people to stay at home. Sometimes that's at home by themselves, sometimes it's with friends, sometimes it's with family, and it's also measures to do with our ability to effectively re-able or rehabilitate people if they've had an episode in hospital or some other situation. Now, you'll see that our reablement service has maintained pretty well the same level of performance as it was doing at the end of the last financial year, which is good. There are some real challenges around our reablement service in terms of the complexity and levels of need that of people coming through have often been much kind of greater than we may have anticipated in previous years, and I think that's been a sign very much of the pressure the health service and particularly the hospitals have been under. So to maintain performance at that level, I think is incredible, really. Yes, we haven't reached the target, but we are facing some, very, very difficult operational challenges in those services. And so I think that's important to know. And I think that particular indicator links perhaps better than the ones that come along around the admissions into residential and nursing care, both for younger adults and for older adults, which is in the next page within this section. And you will see that the numbers or the rate of admission into residential and nursing home, both for the under 65s and the over 65s, is much lower than we were targeting this year. And I think there's two aspects of that. One is we have maintained some good performance in a number of areas such as reablement, but we also know that there's been some significant new investment in other community care services, particularly through the Winter Plan. We've got a lot more crisis support. We've got roving night services. We've continued to invest in technology. So there's some good stories, but we also cannot deny that there has been a greater reluctance of families to place themselves or loved ones into care settings, residential care settings, which has meant those numbers have dropped really, far more precipitously in the right direction than we would have anticipated at the beginning of this financial year before the pandemic appeared. So that's an interconnection there, which is is kind of worth noting, both some things that we're in control of and some things that we're not so in control of. And just in terms of the proportions of people then who have been supported at home, you will see that amongst adults and older people in general, our position has shown improvement, and we're hitting the target. For adults with learning disability, those figures have gone slightly in the wrong direction, and I have tried to get to the bottom of why that might be so, and we can't see anything from the operational arrangements over the last year that would have accounted for that. So it may be, sadly, something to do with the differential rates at which people have died in different settings, and that is still quite difficult to pin down effectively. My operational colleagues haven't been able to give me an absolutely clear picture, and I think Donna will probably need, with her colleagues, to do a little bit more work in the new financial year when things are settled down, just to understand the underlying position on that. So that's it on that section.
Yeah, thank you, Tony. Are there any comments or questions? Lorraine.
Yeah, sorry, Jeff. I just on all of that. I think if you look at how society's changed since the pandemic, that's probably got a massive influence on these figures. I mean, it's about people not going into the care sector. I know myself, my dad's terminally ill, and because of the pandemic, I am able to do far more for him because I'm not in the work environment. I'm working from home than I could have possibly done if I was in Preston 3 or 4 days a week. So I think society's changed massively. Now, I think the impact after, if we do go back to normal after this vaccination, will be massive. And also with adults with learning difficulties living at home, what we haven't got the extra facilities where adults would have gone out and they would have gone to drama classes and pottery because of social distancing. So that's probably breaking down in the homes because the families can't cope, because although they lived at home with other activities, but when it's 24/7 and you're elderly and your children are adults, it's a lot harder to, you know, to do those services. So I actually look at that and go, yeah, I can see the reasons why we're getting those figures. And I think next year, if hopefully we go back to normal, it's going to be absolutely, you know, like a tsunami coming at you, unfortunately.
Yeah.
But just as a comment.
I mean, Chair, if I can just come back, I think
Sure.
think everything Lorraine has said absolutely sounds, you know, right and wise. And I think at different perspectives, whether it's mine or as a director or mine at a family and friend level, you can see these things are happening in amongst the networks of people I'm working with, and we are starting to see, as I suppose there's some evidence from the last month or two, that we are seeing people who we are going to have to do a lot more with to support in the community, and that's because of some of the impacts of the long term of being reclused in your own house and not being able to socialise outside, as Lorraine said as well. On the plus side, and I guess I just mentioned this because I think, Lorraine, hopefully you've actually had a chance to experience this at local level. You've obviously got the extra care schemes opening as well, and I think the one in Fleetwood is now I think opened. I'm certainly signing off the contract. I don't know whether everybody's in there. I've not quite managed to work that one out yet. I was asking earlier on today, and we've got the scheme in Preston. So we've got those 2 extra care schemes as well, and hopefully that will continue to give, you know, or start to give people better alternatives as well to residential care, particularly I think in Fleetwood and in that part of Preston where that new service has opened. So that's another good opportunity, I think, to continue to keep people safe and supported in the community rather than needing to go into residential care.
Yeah, I think the extra care scheme in where I am anyway doesn't open until April, and I think it's a lot of the vulnerable adults with learning difficulties and stuff like that are all shielding anyway until the end of the month, so they can't actually go in until April. Because I know one of my members of the family is like, you know, she used to love it. She's got Alzheimer's now, so but I know she's like booked in for April. You're going, sort of thing. So, but we'll just wait and see. But thank you.
Yeah, the extra care facilities was something we've all pushed for, haven't they? And thankfully we've been able to achieve it in Fleetwood and Preston. That's good. Tony, back to you.
Yeah, so I think Donna, is that all the numbers if I move to Appendix B?
Yes, that's right now.
Yeah, I just wanted to check I don't miss anything out. You're in charge.
You're putting that very kindly, Tony. What you're saying is you don't want to make the same mistake that Jeff Driver did.
So what we've as Donna and I've said, I think on the last occasion and again today, some of those figures do tell a story. Some maybe slightly difficult to tell precisely. So what we've done in the appendix, probably true of other colleagues from amongst the officers on this call, is we've provided some of the I suppose the richness of detail about the things that we've been doing over the last year. And I'm not obviously going to read all these paragraphs out in order because it's quite concisely and clearly written, I think, and it'd be better if people have got questions around it. But just to highlight the areas I think where we feel particularly proud, really. Certainly in recent months, all the stuff that we had to do very early on in the pandemic around hospital discharge were tough. I've got to say, last spring and summer was very tough in that world, the interface between us and the hospitals. We got through it. And then when the new wave of pressures came in the autumn, we'd got some new and different arrangements that we'd put in place, having learned from the first time. And I've got to say they've really paid off. I mean, you'll have heard a lot of kind of talk in the media about the pressures on the hospitals over the last 2 or 3 months. Lancashire has really held its head up pretty high on most of this, both in the context of the Northwest and England as a whole. That's been because of some great work, both on behalf of colleagues who I'm fortunate enough to manage, people such as Sue Lott, Linda Garnsey, Laura Hudson, and their team managers. They've done a fantastic job, but also been working really collaboratively with the leadership in the NHS, particularly in the hospitals. And I think we've really we've had a common purpose over the last year. It's not been the ideal common purpose, but we know we've had to combat the virus and the impacts of the virus on all the population, and particularly those at risk of being in hospital. And there's a kind of lot of detail there about how we've successfully implemented some of the government's mandate around this and actually achieved some much better working arrangements, including setting up of clear decision-making arrangements so that we're able to put best practice in right across the county, that we've got some support that's been coming in and helping to coach and move our own staff along into more collaborative and effective working relationships. We've had these designated settings set up and running, which have offered a safe place for discharge for people who are COVID positive. And we have done a great deal more to promote an active learning culture between our hospitals, because as the county councils, working across 5 hospital systems, it's sometimes been a challenge to get them all to work with us in a way that makes sense to them and to us and gets best practice. And I think we've been really much more successful. So that's around the hospital discharge. We've done our own teams have done some great stuff despite the massive challenges they've faced, and we've done far more than we would have anticipated at the beginning of this financial year, again, to get people through home first referral pathways, which means that when they are no longer in need of treatment in a hospital, we get them home, and that's where we assess whether they're needed. And this is one of the things that undoubtedly contributes to the lower levels of admissions into residential care, because what we're trying our very darndest to do is get somebody safely back at home, assess them with therapy, social work and other interventions, and then if that's working out well for them, that avoids an admission into hospital and gives them a chance to recover. Doesn't work for everybody, and we're not pretending that everybody will be able to stay at home permanently, but it's a better place to make a decision. The other thing I just wanted to highlight, I won't talk about the designated settings unless anybody wants me to go into any detail, but we, at the beginning of around the summertime, we had to develop a winter plan, which would have been signed off both by, I think, Health and Wellbeing Board and probably as well by Cabinet. And that was to agree the investment across the NHS and ourselves into new social care services. We have been, in the main, very, very successful at getting all those services online. So they've served us well over the last 4 or 5 months, particularly with the provider community, domiciliary providers, reablement provider, crisis providers. We've also been quite agile in trying to recruit some new temporary staff. We've had to be, because sometimes we're competing just as fiercely with Blackpool and Blackburn and Wigan and all these other authorities that border on us. So we've had to move pretty fast. But our winter investment has actually paid dividends, and you'll see that that's a lot of money that we've invested. It's been a lot of posts that have been filled. I mean, I know it says 18 out of 60. I think that position's improved over the last couple of weeks, but all those additional hours in crisis and home first have made a huge difference. And we recognise we've got some learning to do, particularly with the recruitment to some of the posts that work for us, and they're national shortages in the main, but we're trying to do our very best in terms of the way we market ourselves as a council to make sure we're picking the best of the crop of new people qualifying out of OT and social work courses through this year. And we have continued to work pretty successfully and again nimbly to keep the Lancashire Temporary Staffing Agency in place. And that's been one of our ways to shore up the capacity challenges in the independent sector. We've had our own share of challenges in the 16 care homes that we run across different parts of Lancashire for older people, but of course there's another 400 or so nursing and care homes, and sometimes it's very unpredictable which ones are going to suddenly suffer a staffing crisis because of COVID or other related issues. So we've got currently a kind of a workforce, a critical workforce kind of work stream that I chair, and that's got a number of things: volunteers who work for the county council who will be prepared to be deployed in genuine emergencies, and as well as this kind of route into care work, which is through the Lancashire Temporary Staffing Agency, which has been cited nationally as an example of good practice, and one which we've had a number of contacts from other local authorities, and probably something we may well want to continue with it in the future as well, because I think it's shown the population of the working age population in Lancashire that there is a route into care and support roles which enables them to have a bit of a taste of what's going on, kind of see one or two different settings, and potentially make a career out of this. And so it's a positive thing, and we've done as much as we can to streamline those arrangements. So I think that's it for me. Probably I should just give a shout out to the, if I can use that phrase, to the Care Capacity Tracker, which is mentioned as well, which is our means of staying in touch with the many hundreds of providers we've got in Lancashire, and we give them daily or weekly telephone calls to make sure everything's going okay, to make sure they're supplied with PPE, if they've got any financial issues with any of the grants that we administer sorted. And the reason for mentioning it again is because it's been nominated for 2 awards, and I think shortlisted on I think the Local Government Chronicle and I think the Health Services Journal Award. So we're waiting for the results on those, and obviously it's great news that we've been even shortlisted for these things, given the immense competition there is on things like digital initiatives of this kind. But a fantastic piece of work by the people who've been leading that. Ian Crabtree, my fellow directors played a big role in that, but some enormous support right across the county council to get that in place, not just adult social care colleagues, but people in BTLS, in our own core systems, as well as many other staff who've been deployed into that area. And I would want to pay again tremendous tribute to them for all they've done to support adult social care over the last year.
Yeah, you're absolutely right, Tony, and I'm sure every single county councillor, not just those of us in this meeting, would echo those words. And I mean, the way the care sector was looked after by you and your teams was absolutely amazing. And as you say, some positives will come out of it because we can keep some of them going. I don't know whether Graham is with us. Are you there, Graham?
Yes, I'm here. Am I with you? I can hear you.
Yeah, fire away, because I'm sure you want to say something about the designated settings.
Oh yes, yeah. I mean, to go back to what was Tony, I echo what Tony was saying. If we remember last spring, when this all came upon us, the National Health Service, the hospitals were full to overflowing. They had to get rid of people. Now, someone had to take the strain, and it turned out to be us that had to take the strain. But the reaction of the officers was extremely good. New innovative ways of working. We certainly, I mean, people popped up who I didn't know from departments I'd never heard of, and suddenly got redeployed and did actually splendid job with all they were doing. So that worked well. As you say, the things we've done, the tracker, as the employment agency, if you like, all those things have worked very well. The designated service centres, yes, for taking people out of hospital who didn't need acute care but were positive. So those were set up quite quickly. 5 centres were set up. A cost of £1.7 million went into that. But they haven't been used very much. I mean, 2 weeks ago, there was only 40% of those beds were filled. And this week, only 25% of the beds have been filled. So it's somewhat, you know, there are no takers thus far. So we'll have to reduce that a bit. If the hospitals want to get people out, we've got the places, but there are no takers so far.
Chair, if I can just
Yeah,
come back, just because I mean, I think what Graham said about the designated settings is absolutely accurate, and I think we are seeing a continued decline, which reflects, it's got to be said, the success of vaccination and testing and so many other things. So we think that the peak demand for the designated settings has now successfully passed. I mean, whether we see a need for them, you know, some point later on in the year, if you know, if we get COVID coming back in some variants or something, I'm not so sure that we may think we still need them, but we are likely to propose in the next meeting I've got, in actual fact, which is why I need to leave for a 3 o'clock meeting, is we are reviewing whether we think we need any of those to continue beyond the end of March, early April. Obviously, anyone who's still in there on the 31st of March, we'll make sure they are supported in the setting they're in until they're safe to move on into a permanent nursing or residential care home, and their infection has kind of subsided. But it will I think seem in retrospect that the designated settings have been an interesting initiative, probably relatively small numbers, but of course relatively small numbers, if that's 120, 130 people, that's made a contribution, I guess, to relieving some of the pressure on the health service and on residential and nursing home sectors, and you know, it's difficult to put that into monetary or any other terms, but has obviously made a contribution. But I think its contribution is now starting to subside, and we probably will end it within the next 2 or 3 weeks, and certainly that's the discussion I'm leading at 3 o'clock as to whether we would really be having any desire to continue beyond the end of March. But you know, we've had great support, I've got to say, from the 5 providers who have delivered these services in Lancashire, and certainly one of the things I will you know, want to talk to Graham about as we reach early April is some recognition of those 5 providers for what they've done in very tough circumstances. Yes, they have been, you know, financially well supported by the council in various ways, and the NHS as well. But actually, I think they've done absolutely everything they can to provide a good quality service in an incredibly fast turnaround, and I think they should all be acknowledged for that tremendous effort on behalf of the local communities and the health and social care system.
Yeah, absolutely. I think we'd all echo that. Are there any other comments? I mean, on the designated settings, we've had some interesting debates. I can't remember the guy's surname. It was called Eamon, who came to talk to us at the Outbreak Engagement Board, and we had some very, very interesting discussions about it. And I guess the provision had to be sufficient for what might happen. And It's all very well looking back and thinking, well, it didn't happen in that way, but we needed to be ready, and it has served a very useful purpose.
And I think, Chair, when we were setting them up, when the government told us to set them up, which was kind of late November, early December, I don't think we would have imagined the vaccination programme.
No.
And indeed, the improvements in the testing programme would have had the kind of results that they've had. So we could have still been facing a terribly difficult time now and over the next couple of months, whereas, of course, the situation looks like it's continually improving. So you know, so yeah, the gamble, somebody, you know, I guess we had to take the gamble back in the autumn that we needed them, and they played their part.
Yep. Yeah, excellent. I don't see anyone else wanting to comment or question, so you can go to your next meeting to talk about the designated settings, Tony.
Okay, thank you very much to everyone, and good luck with the rest of the meeting. Okay, take care. Bye-bye.
Thanks, Tony. Bye now. Back to you, Donna.
Okay, so back to the beginning of the report, really. So we're actually on page 13 of the overall set of papers, and we're on the Lancashire Will Be the Place to Live. And this is now over to John Davis to talk us through the highways indicators, if John's here with us.
Yeah, John's there. Over to you, John.
Thanks, Chair. Good afternoon, everybody. I've not too much to say on these. Just if we're looking at the Q2 results, and this is probably as we would expect. Q2 is probably one of our better performing quarters. We've got the better weather, longer days, which gives us the ability to be out getting these repairs done. Traditionally, once you're moving into Q3, we would notice a bit of a drop off, and this is down to obviously shorter days, and the weather does have a significant impact. We have crews then moving on to doing winter maintenance work, winter gritting, which can impact on our ability to undertake repairs. Having said all that, I think we're not that far off meeting the targets. Certainly, I think if we look at the first two, the 4-hour defect repairs and the 2-day repairs, we're generally dealing in relatively small numbers. So if we miss a couple of repairs, then whilst it's only a couple of repairs missed, it can have a significant impact on the percentages because they are relatively small numbers. But we've looked into if there is any particular reason why we're just missing on some of these things, and it's really a mixture. I think it's set out in the report there that we have had some COVID absences in some areas. We're not had huge numbers, but there's been in some areas just enough to delay repairs. Obviously we've mentioned the weather previously and the shorter daylight hours. We also noticed that some of the reports weren't filtering through the system quite as we would have liked them. So that means it's either not getting to the teams as quickly as we would like, or once they've completed it, that information is not getting back onto the system. So we would miss the time because we can't put these on retrospectively. It may be that we missed it by a day or so, just because of the reporting mechanism. And that's similar in the street lighting repairs. Again, we've had an outbreak in the street lighting team of COVID, which has had some impact. Having said that, looking at the non-traffic management repairs, we're pretty good on them. We're meeting targets. So I think overall, given the fact that we've had to change our working practices due to COVID, which has made a bit of a rethink how we deliver some of this work, we're not doing too bad. We're not quite there, and we're looking at how we can improve that. It's working on all little bits of things, I think, just sort of tinkering at the edges, which will make a difference all round to make sure we meet these targets. So I'm happy to take any questions, Chair.
Yeah, okay, thank you, John. I don't see any questions or comments. Keith.
Thank you very much, Chairman. I think John's been a little bit modest there from my point of view, and I get really involved with highways, as John knows. Firstly, what I'd like to say, this administration did change how we report things. They made us more accountable. We included 4 hours, 2 working days. I think the 5 working day was one. Also, we changed our lighting systems and how we approach that and what we did. And just as all this came into practice, we had COVID-19 came, and it was very, very difficult. And we have had people off, and looking at these performances, I'm really pleased with them, and I think the teams have done a great job. It's been the worst winter we've had in 10 years. We've had crews going out 24 hours a day gritting, and on top of that, maintaining the highways. When you look at the figures, I agree with what John's saying, because of how we do it and because we are making ourselves more accountable. If you look at the 4-hour one, You only need to miss one for whatever reason, or one doesn't come back, and it can make a difference of 10 and 15%, sometimes 20% on the numbers. And the same with the 2 working day one. But on the whole, my thanks go out to the teams. They've been out in, it's been an horrendous winter this time. They've been out in all weathers, and some of these performances are outstanding considering the conditions they've had to work in, the number of people that have been available. Plus, we've had to go out gritting. And a special thanks to the maintenance staff, especially the maintenance staff who've kept all our vehicles running and on the road. Well done, John and the team. Thank you, Leader.
Yeah, thank you, Keith. I don't see anyone else commenting, so okay with that. Thank you very much, John, and I'm sure we all echo the comments Keith made. Back to you, Donna.
Chair.
Thank you. So the next item that we're reporting on is the recycling, and it's predictably unpredictable, I think is probably the best way of putting it. The doorstep recycling has increased by between 5 and 15%, and it's been matched by increases in non-recyclable waste. So you can see it's to do with people working from home, less business waste being collected, etc. I didn't ask anyone to come along to talk to this indicator because I don't think there's much more to say other than what's written in the paragraph here. It's worth noting that in terms of the processing of residual waste at Thornton and Leyland, the plants have remained operating at full capacity and with full transport functionality. So that's worth noting. Don't know if anybody's got any questions.
And did you have anything to add, Albert? I think the paragraphs are self-explanatory, aren't they?
Yeah, they are. I mean, say basically our household waste sites were shut for quite a bit in the first lockdown, which affects it. But the chaps at both Leyland and Thornton, they've done extremely good work, and we let's say we've made a surplus on our targets.
Right, so, that's the right word, Albert.
So basically, well, you know where I come from. But basically, yeah, I mean, say the staff have worked exceedingly hard. Of course, even our household waste sites, we're still under government guidelines about inert waste, which we still can't take, and vans still have to make an appointment. Hopefully that within the next 2 or 3 weeks, we'll be back to normal and we'll be able to take more waste to our household waste sites. I know that people are keeping stuff at home and things like that, which isn't good, but we are where we are, and the staff have done a really. We've had more compliments than we have complaints. Let's put it that way.
Yeah, that's very true. Okay.
Okay. Cheers.
Yep. Thanks, Albert. Donna, are we calling on Dave now? I see Dave's got himself ready.
Dave, go for it.
Yeah, poised, ready and waiting. And the first one is the percentage of children and young people receiving targeted early help support where their needs were successfully met. And there's a narrative around this one, I suppose, where at the start of the pandemic, what we were finding was that families were disengaging for services, and we all went into lockdown and people retreated. So actually what we've found across a number of kind of certainly the early help services, that families have disengaged from services. So when we're recording whether needs are being met, actually if they're disengaged, then we don't have that evidence that their needs have been met. Over the course of the year, then the level of activities picked up again. So families are re-engaging with services, and actually by Q3, the level of referrals coming into our early help, county council early help services were what we would have expected pre-lockdown. So the system has kind of bounced back. So then the question is, so of these cases that are being closed, how do we know kind of what's happening to those families? How do we know that they've been kind of either left with referring agencies to pick up their needs? So we've got programs of work around audit and case reviews to look at how we're closing our early help cases if families are disengaging or if they're not meeting the thresholds for service, just to give us that assurance that actually cases are being closed down safely, and that regardless of whether families' needs are being met through our county council early help services, families' needs are being met. So that picks up the first one. The second one, in terms of the percentage of children looked after living in Lancashire, and we're above target on that, and we have been. I suppose it's important to say that if you look at our placements within neighbouring authorities or a kind of 20-mile boundary of Lancashire, it's significantly higher than that, 80%. We've got a very good supply of residential accommodation for looked after children in Lancashire, but our challenge is for those children with the most complex needs. And I would never miss the opportunity just to remind members that actually it is finding appropriate, good quality provision for those children, young people who have the most complex needs. That is our challenge in Lancashire, and the challenge across the country as well. Ofsted are obviously tightening up now on the system of regulation for children's homes. That will give us some challenges over the next year or so, we think. So that working with our district council partners to encourage the development of the right children's home provision is going to be quite important to us going forward.
Absolutely, Dave. Should we just pause there? Are there any questions or comments? Is that you, Bernard? Oh no, it's Philippa. Sorry, Philippa. Well, I saw.
Now there's a thing.
Yeah, no, sorry. It was just that Bernard put his camera on just a few seconds ago, and I thought he was wanting to come in. But go on, you fire away, Philippa.
Yeah, no, it's
working, Jeff.
Okay, no problem.
No, yeah, I mean, Dave's made some very pertinent and points that I absolutely agree with, but I still think that overall the position that's reflected in these indicators is pretty good, bearing in mind the context. And yeah, I think that one of the reasons for that is that the staff engagement and morale throughout the last 12 months has been really amazing, actually, absolutely amazing. And also the management focus, for right the way through the organisation, it has been, yeah, we're going to have to do things differently. We're going to have to be quite creative here, but actually, let's try and carry on like it's business as usual. And that actually is reflected in these figures and later in the report. I think it's not ideal, and it hasn't been an ideal situation, but it's actually worked in terms of really trying to do the best for the children and families that they're supporting. On the children looked after figure, all those points that Dave made about actually supporting our most vulnerable children are absolutely right. But I do hope that all the things that we've done over the last 12 months will actually help to start bringing that figure further down, and that we will have more and more children who unfortunately have to be taken into care in Lancashire, but are actually being looked after near their families, near their communities, near their schools, because that's got to be the best way for them. Thank you.
You're on mute, Councillor Driver.
Yeah, thank you very much. I've managed all day without doing that. So, yeah, what I was saying, there's the event yesterday is going to have a significant impact on how we deal with the children and families in our area.
Yeah.
Okay.
Absolutely.
Does anyone else want to come on? No, I don't see anyone. Thanks, Dave.
Okay, shall I move on to the?
Yes, please.
Yeah. So I haven't got an awful lot to say on this one, because as we know, the kind of national kind of examination system didn't happen in the way that it would do normally. So we haven't got the same set of results that we would do. And DFE have given some quite kind of clear caveats in terms of year-on-year performance comparators. What I would say is that, as I think I said in the September meeting, we've been working really hard to support schools and to make sure that schools have continued to be as fully open as they can be throughout the pandemic. We've had eyes on those vulnerable children with a social worker or a EHCP, and work very closely with schools to support those children, young people in particular. We've supported schools in terms of providing remote education. We've made, or the county council has made, significant investments in the provision of technology to support pupils, including the kind of more recent provision that's been made. So I think in terms of the support that's been there in the joint working with schools, the whole system has pulled together and worked really hard to try and provide children, young people with the best learning experience that they can have in the circumstances. And we don't know what the impact is going to be longer term, and young people are telling us themselves that they are concerned about their future, and I suppose what I think is we will just need to continue working together with schools, and obviously next week is a big week in terms of the start of return to more fully open schools, but that's got to be a good thing in terms of getting pupils back into that more structured education. But in terms of the actual results themselves, then it is a challenge for us in terms of having hard data at the moment.
Yeah, thank you, Dave. Philippa.
Yeah, no, we do have to be cautious, but we just have to build on what we've been doing. Those partnerships in particular are essential for us to get that support and that learning back on track. And it'll be a long process in my estimation. And I think that's what the schools believe. I'm sure it's what county council colleagues believe, but we've just got to build on it, and those relationships are there, and because of the pandemic have actually been developed in ways that we perhaps didn't expect them to, and we should use that as an opportunity. Thank you.
Yeah, thank you very much. I don't see anyone else, so thank you, Dave. That's very clear. Good luck next week. It's going to be an interesting time. Does that take us to page 8, Donna? Yeah.
Yes, it does, because there's nothing to say on health checks other than it's been suspended. So yeah. Yes, so we're on to the Lancashire will be the place to work, and looking at libraries in particular here. I have to say the library services have done some phenomenal work. They sort of ignoring the fact that the indicators are flashing red, which I have to say that performance colleagues and I have agreed that we've been harsh. If you've missed your target, it's going to be red, which seems a little cruel, but that's the way we're presenting it. So looking at the use of libraries, we haven't invited anyone from library services here to talk about it, but looking at the use of libraries, they have absolutely done their best to deliver everything that they possibly could within the legal framework that they were operating under. By October, they had all but the 2 static libraries and 4 mobiles had reopened, and they got the COVID safety restrictions and minor reductions in opening hours, and obviously no in-library events were being organised, but they did do library events online. When the restrictions have hit, they've had to limit themselves to pre-ordered and click and collect loans, and they've managed to keep the People's Network, PNet, running as far as possible whenever they've been able to do that. So we've had PNet sessions available at all open library sites. We've had to restrict it down to users with pre-booked essential computer sessions where permitted when we've been in lockdown, and that's been for people who don't have access at home, people that need to use it for universal credit, free school meals, job searching, that kind of thing. Watching a funeral, we've been able to allow people to do that. There's been library events organised online, got competitions, adults and children's book clubs, themed virtual Lego building, which sounds like fun, children's book of the year presentations, author interviews, local arts videos and quizzes. It's been really innovative stuff. The e-downloads have obviously shot through the roof, which is to be understood. But actually, we've also introduced new formats. We've got e-magazines, e-newspapers, and e-comics, and that's really helped. And there's been a major increase in usage. And the volunteers in libraries, quarter 3's seen some volunteer operated services running. We've had 64 volunteers on the home library service, with 19 carrying out library services to housebound clients. We've had telephone befriending roles. There's been absolutely all sorts going on. So there was 13 Culture Hack volunteers also attended online events, which helped develop further online activities for younger people. So there's been a lot. There's been a lot happening there. I don't know if anybody else wants to come in on that.
Yeah, excellent. Peter.
Yes, thank you. And thanks for the report. I mean, I think there's a theme today of commending how excellent the staff and the service have worked under quite incredible conditions this last 12 months. Certainly on the library front, I know full well how well the public have sort of felt how safe they've been when they visited the libraries. I think I just want to point out a couple of things. One thing that is actually missed on your list of initiatives that have introduced is the 6 of the best, which was introduced as part of the when we went into lockdown, as a way of, because people couldn't go into the libraries to browse, then we're using the professionalism of the staff to pick 6 books, and then people collect them from a bag at the door. And I know that's been extremely well received. And I think the intention is to carry on when we go back to normal opening hours, because that has been a really good initiative. And there's been a sort of similar one for younger readers as well. So sort of some targeted reading to introduce new authors that people might not know. The other thing I think I do want to mention is the e-downloads and the new initiative of the magazines and the newspapers. That was originally to be introduced in summer, but when we went into lockdown last March, the staff pulled out all the stops to bring it forward, knowing that the libraries were closed. So again, it's just an indicator of how great the service have been pulling everything together. And it's not just the libraries. I would sort of extend that to the other parts of the department, the archives and conservation team, etc. But no, it's excellent.
Yeah, it is, and I think it's also worth, as the report does, pointing out the worth of the volunteers and the friends of the various libraries. I mean, they've also done a marvellous job through this period.
Yes, they have, and some of, if I may just sort of comment about the befriending service, because that was something with some of our more mature library users not being able to go out and sort of meet their friends or whatever in the library setting, then that, as I know, has been really invaluable. And I've seen some anecdotal testimonies, if you like, of how that's meant to people. So no, it's excellent. Thank you.
Yeah, it is, absolutely. Okay, page 9, Donna.
Yep. So thank you very much. We're still on Lancashire being the place to work, and looking at the percentage of young people in employment, education or training, and also percentage of young people in employment, education or training with SEND. Yeah, again, it's a very positive story. The renewed relationships with secondary schools has had a positive impact on those figures, and we've so right across the board we've had a positive impact. There's been a lot of work that's gone on, particularly tracing the unknowns. So where we've got the EAT, we've got the NEET, as it were, so they're not in employment, education and training, and obviously trying to reduce the numbers that are in that bracket, people that we don't know about, and people that we can improve their life outcomes from targeted intervention. And it's a good news story. There's been a lot of work that's gone on, and it's very positive. Yep. So the report does flag up that further work does need to be done in relation to how to track young people for whom there are no contact details at all. So you know, that's something that they're working on, but it's very positive. Yeah, that's always a problem. Philippa, I'll bring Dave in before you, if that's okay.
That's fine. Yeah, that's fine.
Yep. Dave.
Yeah, it's just to echo what Donna's just said, really, that it is an area of positive activity. We know we've got more to do, but I think the relationships that we've got with the schools and the colleges are strengthening all the time at the moment. So if you take, for example, our young people with SEND in Lancashire, we're having discussions with the colleges as part of their COVID recovery plans now about actually, as colleges move to further opening, how can we secure more placements in those colleges? So it's about taking every opportunity really that we've got in these areas. We've obviously still got our own Project Search programme going in terms of placements within the county council, and that continues. And same in terms of our looked after children, then it's about trying to create those opportunities within the county council for our own children looked after as part of our corporate parenting responsibilities. And those are both very live issues and things that we are absolutely working to continue alongside the broader EAT agenda.
Yeah, absolutely. These results are remarkable in present circumstances. Absolutely no doubt. Philippa.
Yeah, I mean, just to support everything that's said, it does reflect a huge sort of cross-departmental actually focus, and also a kind of change of approach, particularly on the children looked after from the corporate parenting board, have really honed in on this subject in particular, and taken a more detailed and forensic look at it to try and support the efforts. So now that's clearly paying off. So that's really pleasing. And I think we all recognise that as we come out of all of this, it's just going to be more and more important to be able to keep the momentum going, because young people have been so badly impacted as a result of the pandemic. So yeah, really pleased with the results, and long may it continue. Thank you.
Yeah, thank you. Donna, where do we go now? We're on page 23 or page 11, depending on which page you're using, which is Lancashire will be the place to prosper. And I'd like to bring Andy in now, if that's okay. Yeah, Andy, over to you.
Thank you, Chair. And another page of red, but some good stories behind those kind of stark headlines. So the three indicators that are represented in this this dashboard are firstly around the number of Rosebud loans that have been provided. So that is in the context of both the number of loans and the value. So obviously Rosebud been the council and LCDL's investment vehicle for over 30 years. Q1, we were still able to place 2 loans to a value of £310,000. But as you can see, after that, the investment levels have dropped off markedly. So at the moment, we are somewhere in the region of £690,000 worth of loans on a target of almost 1.6 million. As you can imagine, through the pandemic, the investment climate has changed markedly. First of all, business appetite for expansion and growth in terms of loans has dissipated. We did see some early interest from companies involved in the manufacture of PPE and face masks who wanted to kit up and wanted to increase production and do their part in terms of the provision of that kind of kit to the health service, but that was not sustained. And then the second factor around loan performance has been very much the availability of, first of all, the COVID business continuation loans, the CBILS, which were distributed through the commercial banking sector. And secondly, the bounce back loans themselves, the BBLs. And we know from the British Business Bank, who've administered both of those schemes, that over 50% of SMEs in Lancashire have actually taken either a bounce back loan or a CBIL over the course of the pandemic. So we understand that that's been necessary and a useful national tool for those businesses to access to see them through the pandemic. It'll be interesting to see as we hopefully emerge in the latter half of this year to a more positive economic climate, what the level of debt within the economy will do to the ability of businesses to access growth finance when they need it. We're actually shifting our emphasis more towards equity finance and making sure that there are networks of equity investors right across Lancashire who can pick up that opportunity as businesses come out and potentially need to go down an equity route to secure more cash. Second indicator, well, the second two indicators both refer to the performance of Boost and looking at the level of job creation for Boost across the year, which is generally and has been for the past 6 or 7 years about 1,000 jobs a year attributable to the business support activity that we run through the Growth Hub. That is down markedly, and again we've seen businesses both furloughing existing staff and being reluctant to take on additional staff, with a few exceptions potentially in the health and digital markets. And secondly, new business establishment, which was practically zero in Q1 and 2, but has seen a slight recovery in Q3. And indeed, we are seeing quite a resurgence in terms of the number of new businesses being set up. None of that is to say that either the Growth Hub or the business support services have been quiet through this period. We've roughly doubled the number of inquiries that have been coming into the Growth Hub from Lancashire businesses. So we've typically done 1,200 3-hour conversations with businesses over the course of a 12-month financial year. By September, we'd achieved that target already within this year. So we've got double the capacity of calls coming in. We've dropped any criteria we had that would restrict businesses from accessing the service. So effectively, we've taken all comers in terms of business support. We've administered £1 million in ERDF COVID grants, which have been paid out to local businesses for kit and provision that will help them to continue trading through the pandemic. We've set up an extensive network of peer-to-peer groups where businesses are helping themselves and using their own experiences. We've got the second largest cohort in the country, and we've just got confirmed investment of £360,000 from BEIS for that to continue in the next financial year. And finally, we've assisted retailers to retrain in terms of retailing from a digital platform, so that those people who've been shut down for the longest in town centres can continue to actually trade their way through the pandemic. Thank you.
Excellent. Thanks, Andy. Do we have any echoes? Michael.
Thanks, Chairman. There's not really a lot to add to what Andy has very well set out. I think with regard to Rosebud is a product which is extremely well regarded, including outside the Lancashire area. But unfortunately, it's been a victim over the last year of the success and the generosity of the government schemes in terms of loans, which have been offered on much more favourable terms, and of course government backed, so without risk to the lender and the borrower. So it's been difficult for Rosebud to compete in that marketplace, and we'll watch how that goes moving forwards. And with regard to Boost, Andy has set out a lot of the areas that they've been involved in. And it's just an opportunity to thank Andy and all the team and our partners for what they are doing. And they're always coming forward with new suggestions and new innovative ways in which we can help Lancashire businesses to move forward and to tap into new emerging markets and make sure we put them in the best place to succeed as we come to the end of the pandemic. But yeah, the last 12 months has been challenging. We've had to repurpose from day one in terms of ensuring that support has been there for businesses and then moving back towards starting to think about growth. But it's almost come like a wave backwards and forwards as we've gone through the different stages of the pandemic. But there'll be a need for support for some time to come, but I'm confident that we've got the right team in place to deliver that moving forwards. And with a number of initiatives to drive forward the Lancashire economy and our business community. Thank you.
Yeah, absolutely. And all the work that's been done for the Ministerial Task Group,
Absolutely,
which hopefully, Andy, that will come to fruition at the next meeting. Andy, can I just ask about, because I think you raised a really interesting point about businesses not being able to afford to borrow, and therefore we're going to have to be looking for equity investment. How are we going to do that?
So some parts of Lancashire are very well served by angel investor networks. So those are, sort of high net worth individuals, probably come out of a career in business themselves and are looking to invest their own capital sums in emerging businesses. Typically, those angel investors invest in businesses in their own locality. They actually contribute sort of managerial expertise as well as cash to those companies. And they often like to invest in sectors that they previously traded in themselves. So they bring both equity and experience to those businesses. The angel network across Lancashire is patchy. We have Bay Angels up around Lancaster and Morecambe who've been very active. We've had on and off provision in areas around the Fylde coast, but the real kind of void in the map is East Lancashire, and that's not down to a lack of high net worth individuals. The people are out there, but we've never been able to sort of access the right structures to actually make sure they're in a coherent and well understood group. The government's done its part. There are substantial tax incentives to invest through angel networks. So it is a very attractive proposition for people who are looking to earn a decent rate of interest on a significant capital sum. But I think we just need to use the other services that we buy in. Access to Finance have got a specialism in setting up those investor networks and have done so very successfully in Greater Manchester. But we just need to push them harder in the next year to make sure that Lancashire's got that full comprehensive coverage across the geography.
Yeah, good point. And I like the fact that we call them angels rather than the dragons that are that are on the TV. Well, yeah, more power to your elbow, and clearly we need to be pushing it in the east of the county as well. So yeah. Thanks very much. Are there any other comments? I don't see any. Thanks very much, Andy.
Thank you,
Donna.
Yeah, so I think now we're on to page 28 or 16. We're looking at the number of working days per full-time equivalent lost to sickness absence, which is red as well. Having said that, it's actually a significant improvement really on where we were this time last year. So it's going in the right direction. So we've actually observed a continual decline in sickness absence for 7 months in a row. And there's actually been a reduction in the number of days lost for both long-term and short-term absences. But the most noticeable decline is the short-term absences, and that's due to coughs, colds, etc. So that's obviously not been happening as much. Mental health-related absence is the top cause for absence, and it's accounting for nearly 40% of days lost, which is a slight increase. Also, COVID-19 absence accounts for around about 7.5% of days lost. We've also got an increase in the number of individual cases of long-term absence, and that's attributed to delays in medical appointments, operations, etc., which is due to COVID-19. And this increase in long-term cases can predominantly be seen in 3 distinct service areas which are directly affected by the COVID-19 pandemic. So HR are directing their resources to these service areas to offer more targeted support to manage their long-term absence cases.
Yeah, thank you, Donna. I don't see anyone wanting to comment, so we'll note that and move on.
Okay, so we're now on to Appendix B, looking at, just a minute, we should have the children's services bit, and I've lost it. Oh, there we go, page 38 or 8, depending on which one you're using, but it's page 38, and it's over to Dave again, please.
Okay, thanks. So this is a really positive picture, I think, in terms of how performance has changed over the pandemic, and hugely challenging time in terms of being able to undertake visits, being able to undertake assessments in the same way as for the Children and Family Wellbeing Service that we talked about earlier. But actually, throughout the pandemic, social workers have just found different ways of working. And it hasn't meant that young people haven't been seen face to face, but cases have been risk assessments, and where it's been appropriate to have a visit, then that visit has happened. And same for things like family time in terms of contacts with parents, that the service has just worked in a different way. Yeah. So the first indicator that you've got there in terms of assessments should actually be assessments under 45 days in terms of the figure that we've got in there. I'd be a bit worried if it was the other way round. But actually, if you were to roll back the clock 3 years or so, you'd be looking at a figure of around 70% in terms of performance. A couple of years ago, you'd be looking at 80%. So if you put that in the context of a journey of social care in Lancashire over the past few years, it's a really positive picture. And great that that's actually been sustained throughout the period of the pandemic. In terms of numbers and rates of children with a child protection plan, it is our intention to reduce those numbers, and actually throughout the last year, then our numbers and rates of children on child protection plan have fallen significantly. So it's about trying to hold that risk in a different way. You mentioned earlier the launch events for the family safeguarding programme, and that is part of what we're trying to do. We're trying to stop those needs escalating so they get to a point where children need to be either on a CP plan or taken into care. Repeat child protection plans, again, positive picture that you don't want those repeat plans coming back in, and what we've seen is performance improving in that area through the year. Up-to-date visits, there's been a bit of a fluctuation there, but actually we checked on the January performance and we're currently on 91%. So even though it has dipped a bit, actually, by the time we've got to January, it's gone up. And I think that's a reflection of the really strong performance management arrangements that we've got in place within social care now. So through Donna's team, we have a range of kind of performance dashboards, which allow managers to drill into performance on a monthly basis. Not just at a Lancashire level, but to drill down into actually what's happening in localities in their teams. And that really is being used to drive things. So when we spot that something isn't working quite as it should do, we can actually take some quick action and do something about it. The rate of children looked after, and Lancashire has always had high rates of children looked after. Again, that links into the conversations and the work around family safeguarding to actually reduce those numbers. Throughout the pandemic, numbers have stayed relatively stable. We've always had this fear that our numbers would start to increase significantly. We haven't seen that, and actually in the last few months we've seen some quite encouraging signs that our numbers of children in care are starting to fall. So I would never say that that's a kind of miracle in terms of them falling really rapidly. But actually it's a positive picture in terms of the direction of travel. And we've always had the view that actually it's about having the right numbers of children in care. It's not necessarily about having to drive the numbers down or increase the numbers. Actually, if the young people needs appropriately to be in care, then that's where they should be. Percentage of CLA with up-to-date health assessments. I think this is another kind of really positive story throughout the pandemic, and one that actually some things take you a little bit by surprise. And I think this is one of those things where, with the kind of narrative around access to health services and people's concern about access to health services, we weren't sure how this one would go. But actually it has been partly because of the lack of activity probably in other parts of the system. It's given the capacity to make sure that young people are getting the assessments when they need them. And it's another one where we've had a real challenge over recent years in hitting that target, and actually we're getting there in terms of performance now. A different issue in terms of up-to-date dental assessments. I think that reflects the picture across the country at the moment in terms of access to dental services. But what we would expect is, as the country opens up and we recover from COVID and we get more normality in our lives, then obviously that picture starts to improve. And in terms of the percentage of CLA with up-to-date visits, then again a positive picture, that actually those visits have maintained. Different ways of doing them, so some are garden visits, some are virtual visits, some are actually face-to-face visits, depending on the level of risk for that young person and that family. So overall, I think it's quite a positive picture that we've got in terms of children's social care performance over the past quarters.
Yeah, I think it's amazing. I think you've done really well to get the percentages of the dental visits as high as you have in the circumstances. Philippa.
Yeah, I wouldn't worry too much about the dental one, but the other ones are fantastic, really. And I think the two things I just comment on, really, that those results have been achieved whilst at the same time introducing family safeguarding, which is no mean feat, to completely restructure your organisation across the piece, to train staff to sort of develop new policies and procedures and an IT system to support it, get all partners engaged, and keep going with all of this is an amazing effort by everybody, so everyone should be congratulated on that. And I also wanted to sort of just comment actually on the impact of scrutiny and the corporate parenting board, because not only as across the executive have they been aligned on what they wanted to do, but politically we have, and members from all parties have helped with that, because scrutiny has been focused on trying to assist and constructively support what was happening in the service, and the corporate parenting board have as well, and that's a sort of cross-party effort. So I just wanted to sort of recognise that and recognise the impact that it can have over a sustained period if we all pull together. Thank you.
Yeah, absolutely. I don't think there's any disagreement right across the council chamber in terms of these are the people we really have to look after. So, well done, Dave, and everybody in children's services, done an absolutely marvellous job. I don't see anyone else. No. Thanks, Dave. Donna.
Okay, thank you. We're now on to Appendix C, which is the Customer Access Service. So could I bring in Terry, please?
Yep. Welcome, Terry.
Thanks, Chair. I just probably, first of all, just wanted to touch very quickly on the content and I suppose the style of the report that I wrote for that, because it's probably not the type of report that we would usually produce, where we work in a contact centre and are very used to measuring and analysing every type of data you can think of, really. So normally a report from us would have a lot of stats in there, but I didn't actually think that it would give a kind of a true reflection about what our performance has been like over the last 12 months. But I mean, I can tell you that the performance, in terms of the number of calls that we've answered and the time it's taken for us to answer those calls is actually better than the previous years. But that's probably, if we're being honest about it, more reflective of the impact of the pandemic, because we've had less contacts, because people haven't been accessing services in the same way, and the school closures has had an impact on that as well. And also the fact that our staff have gone from working in an office constantly to working from home, and that's been very interesting because it's had a very positive impact, certainly on our retention, but also in terms of our attendance as well. Our sickness levels, because I know Donna was referring to those generally before, but our sickness levels halved during the sort of last year going into the summer and autumn, because I think that's just a natural impact of people protecting themselves from COVID, have also protected themselves from those flus and viruses and bugs that are going around as well. So we've had more resource and less work to do. So so it doesn't really tell you an awful lot if I'm saying, well, our performance has been really good. So I've tried to focus on the support that we've done to various different areas for COVID, simply because I think that really tells you a little bit more, and certainly in relation to the relationships that we've built up with different people. So from an individual point of view, the customers that we deal with on a daily basis, they've felt the impact of that, because very early on, when we went into the first lockdown, we realised that there was a huge number of people that would have additional needs because they were shielding, for example, and certainly a lot of confusion and a good deal of anxiety about that as well. So we made a conscious effort to be a bit more proactive about opening up the conversations that we were having with people. So if somebody was ringing up for a blue badge, for example, we didn't just make the assumption that that's all their needs were on that particular day. We opened up the conversation to find a little bit more about their circumstances, and that really led to actually finding out that people were struggling but didn't actually know where they could get in touch with. So we kind of countered that by setting up some very close relationships with the community hubs and the district councils that formed them, because they really struggled. That was dropped on them, obviously, at the last minute. So we were able to help make sure that they had a level of consistency, and we brought them together. Even now we chair fortnightly meetings with them to make sure we've got all areas covered in that way. In relation to we obviously provide the first line of contact for a lot of LCC services currently, but we've actually worked with some services that we haven't worked with before. So coroners, for example, in the summer of last year, we set up a process to make sure that if we did have a situation where the excess death cell needed to be introduced, that we'd have a 24-hour contact centre where people could contact us about that, and thankfully that didn't come to pass, but we were there and prepared for that should that happen. And we've worked a lot with public health as well, especially on the testing and test notifications, which is it was something of a kind of a last minute ask, really, because I think the assumption was that Public Health England would be responsible for those test notifications, and it was our responsibility because we'd actually gone out as an authority to do those tests. So I think we sent out 30,000 plus test notifications, which was obviously very important. But there's also, there's a lot of external organisations that we've worked with. Tony Pounder was talking earlier about the care capacity tracker work, and since September, we've been making those daily calls 7 days a week. And the interesting thing about that is it's not just getting the information that's useful for us as an authority to understand that everything is on track or there's no areas of concern that way, but it's also building up individual relationships with each care home or domiciliary care provider, which has probably been has been lacking over the years, really. So they've really benefited from that. And very recently, since December onwards, we've been working very closely with the NHS on the vaccine rollout. They have probably underestimated the level of organisation required to do that logistical exercise, and have got themselves in a little bit of a mess. And so they'd asked if we could help out, which we did, and they've been so grateful for it, and it's an area where we've never had a close relationship before. That's probably been through adult social care a little bit more than directly through ourselves, and we've, if you like, formed a direct relationship with them, and done our relationship no harm whatsoever, which I think will stand us in good stead going forward, because there's a lot of reform going on both within local government and within health, and possible integrated health and social care models that have been mooted as well. So that's been very encouraging as well. So it's more of a qualitative report, perhaps, really, but it does give you an indication of all the different areas that we've worked with and supported. And if you read the report, it kind of flows through of that initial we've been hit by the pandemic and we need to support the people, and then it's about trying to support our services in reopening, the waste sites being reopened, libraries being reopened, registrars who had built up a huge backlog of birth registrations that we were able to help out with and clear those for them. And then really about moving forward, trying to work with different organisations to try and to actively respond to the pandemic, and certainly through the vaccine work, trying find a way out of this. But I think that will continue for some time. Really, it's not a quick fix. It's something that will continue, I think, throughout this year, and probably still be here this time next year talking about vaccines. So I hope it gives you a flavour of what we've done. But if anyone's got any questions, I'm happy to take them.
It does indeed, Terry. Thanks very much. Another success story. Peter.
Yes, thank you. Thanks, Terry. This area, customer access, it comes under my sort of portfolio responsibility. And I just want to thank Terry and the team, and obviously Terry's predecessor Sarah for the work that you've done these 12 months. I think this is a really sort of good summary of everything that you've done in the 12 months. It was really just a question moving forward as we're coming out of recovery. You've obviously had to implement a number of procedures, staffing wise, especially as you say, they're working from home. I presume that there's a number of things that you can now take moving forward, so it becomes an even more comprehensive service, if you like, because you've got that hybrid of potentially home working and in the office. And I just wondered if you could give a view on how you see that moving forward, and some of the benefits that might come out, if you like, out of all the negative that we hear from that's happened with COVID, by being forced into looking at this, just how the sorts of things that you moving forward that you might think would be very productive for the council.
Yeah, I mean, for anyone that doesn't know our service, obviously it's a contact centre. So if you've never been over to Lancashire House, to give you a picture of it, it's a lot of people all sat within one room, working very closely together as a team. So it's a big culture change for us to be all then suddenly working from home, and we had to really think hard about our communication strategy. And one of the things that we put in place very early on was to do quarterly surveys with everyone to understand how they were feeling, how they were, because as Donna mentioned earlier, mental health has been a real cause of concern for long-term absence, not just in Lancashire, but throughout the nation. And we were very conscious about that, the isolation and how that would affect people. So we kept in touch with them. We've had 3 different surveys. And one of the things that we've constantly asked is how they feel about home working, and, looking forward into the future, whether they would like to continue doing that. And you have the vast majority of people that are basically, it's got a small percentage of people that it just doesn't work for them, and that they would like to work in the office. But the vast majority of people would like to have at least some aspect of home working. And it very quickly worked out that, especially people with families, working from home, they weren't paying for petrol going to work. And, there's an environmental tick there as well. But the after school clubs and things like that they could balance all that if they could work from home. So they kind of put themselves forward very early on for doing that. And I mentioned earlier about it's affected our retention, because it's a contact centre environment, and it's not for everybody. And I think people often want to move on in their careers. So the average length of service is about 3 years in customer access. But some of that is actually just not due to people disliking the job or the role or anything like that, but often roles come up within the authority that just have a greater level of flexibility. And if we can offer that by introducing elements of home working, it should actually increase our retention long term going forward, which ultimately benefits the customer, because the problem that we have, we can keep recruiting to replace people, but you're going from an experienced member of staff to somebody that's at ground zero again, and then you're having to build those up and train them in all the different services and get their experience and their confidence going, really. So it'll have a real beneficial effect for us if we are able to have that balance of office and home working. And I'm not saying we would want to continue home working entirely. I think having an office environment where people can come in and meet up as a team is important as well, because the social isolation has been a factor and a concern for everybody, I think, really. But getting that balance right going forward will be really interesting, and it will also, I think, help us develop some of the channels that we offer, because we take telephone calls, take emails, we deal with social media, we deal with web chat as well, but it's only in its infancy, really. And I think in order to get the best out of web chat, what we need to do is offer it at a time where the public are trying to self-serve, which is generally in the evening, really. And the last survey that did, it's one of the questions that we just tested out, because some people had come forward to say, it would work well for me to actually start later in the day, work into the evening because of my family and my home setup, really. So we could then potentially offer a web chat service out of our normal office hours, and therefore reduce the amount of calls that we receive during the day, because people would self-serve and we'd be able to assist them self-serve at night, really. So it's there's a lot of opportunities, I think, for us going forward, and we'll be working with the facilities management and asset management to understand the outcome of the accommodation review, and then when we understand that a little bit more, then we'll go out to our staff to try and build a long-term working arrangement for them.
Thank you.
Thank you, Sean.
Yeah, thanks, Chair. Terry, it's really good to see this report. You brought it to life well. Like you say, the stats maybe wouldn't have painted the picture you wanted to. Not that I'm saying you've painted it deliberately. It is what it is. But just looking through it, there's obviously a lot of things you've had to deal with. Peter covered some of my point about capturing the stuff that's really worked and taking that forward where we can. But it strikes me that in a virtual world that we've been in, it's really important. Good communication is really important. And you've done that very well. I've heard many of the the feedback of contact with ourselves, and it's been positively felt out there on the battlefield, if you will. So absolutely great to see. Like I say, you've had a lot to deal with just looking through all the COVID related stuff, and I think we'll all be glad to see the back of all this return to that element of normality. But as Peter has said, capture those good things and let's move forward with an agile, modern service. But I felt I had to come in because you're a service that maybe doesn't attract. It's not a glory service in any way, and that's not putting you down, but you've done a really important job. So thanks for that.
Yeah, absolutely. Would echo that. Philippa.
Yeah, I would as well. But just to sort of pointer, really, a comment from a reporting perspective. Facts and figures are really good, and I like them, as people know. But actually, understanding how it feels and that sort of qualitative perspective is really good. It brings it to life. So I just flag up that may be something to think about in the reporting of what goes on in the customer access centre in the future, because it actually does give you a real sense of what's been going on over the last 12 months. So thank you.
Yeah, absolutely right. It's an excellent report, Terry. Well done. Have we any other questions or comments? No, I don't see any. Donna.
That's the whole agenda item, which is one agenda item, funnily enough, but that's the whole one. Done.
Yeah. It is. So thanks very much. But I think it would be remiss of us not to record. I mean, we've obviously, because some people have been here and we thank them for their contributions through the pandemic and everything that they've done. But I think as the performance committee, it is important for us to recognise what every single member of the county council staff has done, and to record, Joanne, if you could record in the minutes that we really do appreciate it. We think it's been an absolutely sterling effort by the county council staff in every department. Yeah. Okay, so that brings us to item 6. There is no urgent business, and sorry, item 5, and item 6 is date of the next meeting, the 20th of April. So thank you all very much for your attendance, and keep safe and well. We'll see you all soon.
Goodbye, everyone.
Thank you.
Bye.
Bye now.
Thank you. Bye.